how soon before the US begins to flatten out its own curve, like what we've seen in China and in South Korea?
Well, the real restrictions are about a week and a half old. And I think New York may have reached the peak. It'll take another day or two to figure that out, but other cities are peaking as well. The big question is whether we're going to see other cities taking off where there will be transmission in Atlanta, other cities in the United States, because there are some who predict that other cities will follow. I'm not so sure about that. I think as the weather gets warmer, as people follow the restrictions, we may see less peaking in other cities.
Professor, we've also spoken with other medical experts and health professionals who have suggested that as the virus continues to spread and eventually our understanding of it also continues to mature, it's likely that this is going to become not a pandemic, but an endemic. Is that your own view?
Well, it may. With flu, it would certainly be. With a flu pandemic, it starts, it spreads, it goes down when the weather warms up in the northern hemisphere and comes back in the autumn when school opens and normal activities begin again. I'm not so sure about this virus. Don't forget about SARS. SARS is a very closely related virus. We all predicted in 2003 it would never go away. It would continue to spread. So this virus is different, and we really don't know. We really just have to be prepared for any eventuality.
And of course, we've learnt a lot about COVID-19 in recent weeks and months. We've learnt more about the characteristics of this virus, how it spreads and its impact on our bodies. But Professor, what is it that we don't understand at this point? What are the questions that the medical community is still looking to be answered about this virus at this stage?
We really don't understand why it picks on certain cities to take off. For example, in the US, the entire West Coast, San Francisco, Los Angeles, has as much contact with some of the initial hotspots in Asia, and probably more than Seattle. Why did it take off in Seattle? We really don't understand that, and we really haven't seen it take off to that extent yet in the other cities in the West Coast. And then we have New York. New York has a lot of reasons to have severe transmission, but other cities in the East Coast have not had the same experience. Boston had a big local outbreak, and it really hasn't taken off to the same extent. These asynchronous outbreaks are very unusual, but what this means long term is that I think we're all going to have to deal with flare-ups for a period of time, which may not be very good for getting people to move around except locally.